Hello, friends. Welcome to CNS Viewpoint. Today, we will be talking about few important points which I heard from the recently concluded National Conference of Indian Association of Paediatricians (IAP), or the conference is also called as PEDICON 2022. It was held in Greater Noida, near Delhi, and so basically, the public health leaders and infectious disease experts of Organized Medicine Academic Guild of India (OMAG, OMAG) said that we should not lower our guard while we are opening up, social activities and economic activities. We should keep our guard up as much as possible while we open up economic activities, social activities. We must invest more in health. We must invest more in public health. We must invest more in strengthening rights-based access to health services. We must invest more in researches and evidence to show whether any further dose or booster will work. Should we reduce or increase or change the vaccine dose? Should we combine different vaccines? Is it going to help or not? We need all these science-backed and evidence-backed policies, so that they can drive our programs and implementation on the ground. And of course, we have to go ahead with the vaccination. So, Dr. Ishwar Gilada, a noted infectious disease expert and also the Secretary General of Organized Medicine Academic Guild of India, had said that we must embrace SMSV campaign, the sanitation, mask, social distancing and vaccination, four components, campaigns to break the chain of transmission of coronavirus, which is extremely important as we are opening up. We should not lower our guard down. All our effort should be to break the chain of transmission, not get infected ourselves. And if we have got infected, then we should do our level best to protect others who may contract infection from us, such as our family members and loved ones in our homes, or people we travel with in public transports, or may be close to them in social spaces, so in markets, etc., or in workplaces. So that is why mask is so important. That is why sanitation is so important, and that is why social distancing is so important as far as possible, given the realities of your life and situation. So, but SMSV is so important. It's really important as far as possible. If you are eligible for vaccine, please do get it. If you are eligible for precautionary dose, please do get it. It is very, very important. Dr. Sunila Garg, she's the national president of Organized Medicine Academic Guild of India, OMAG. She and a noted public health expert. Dr. Sunila Garg had also said repeatedly, not only about reinforcing prevention should continue to remain center stage as we are opening up, but also she reinforced that the need for different medical super specialities and medical specialities and their associations to come together to unite for a very well coordinated response in cases of pandemics and health emergencies. Organized medicine is an extremely important cog in the wheel of preparing for and responding to health crises, and OMAG had played such an important role. That is why Dr. Sunila Garg and Dr. Ishwar Gilada thanked the Government of India's NTAGI, the National Technical Advisory Group on Immunization, for taking up their suggestions. The suggestions, offered by OMAG several times, and they thanked Ministry of Health and Family Welfare for implementing some of those suggestions as well. So, of course, again, I'll re-emphasizing what experts of Organized Medicine Academic Guild of India had said, that the response to COVID-19 must remain evidence-based, science-backed as far as possible. This is so important. Health should continue to get more priority than ever before. COVID-19 has shown us that economic activities are only possible when people are healthy and well. And that is, and all people are healthy and well. It is not possible for a small number of rich people to keep vaccinating and boostering themselves and find a way out of the pandemic and let the pandemic remain in the poorer parts of the country or poorer parts of the world. If the virus is circulating in human population, the new variants, there is a threat and there is a risk of new variants to emerge. So the only way to break the chain of only the way to control this is to stop it from spreading, to break the chain of transmission, and we know how to prevent infection. We have also seen that if we get infected by coronavirus, then the likelihood of being hospitalized, of needing oxygen, ventilator, or dying of COVID-19 is very low if the person is fully vaccinated. So this is also very important, as if you look at the Omicron data, you will find that most of the hospitalization, 90% or even more in different countries, different places, were among the unvaccinated. So in a way, the pandemic, the serious part of the COVID-19 Omicron wave was, was on the unvaccinated. And we are responsible. The inequitable system is irresponsible. The socially unjust system is responsible for the situation because world produced enough vaccines for everyone to protect everyone. But the way the vaccine rollout has happened, so we have a situation where people in rich nations have got vaccines many times over, even fourth round in some countries. And we have billions of people, I think 3 billion or so 2 months back, who had not even received a single dose of the vaccine. So this is just another evidence that of how inequitable and socially unjust we are. And unless we rebuild in a way which is socially just, which is ecologically sustainable for all human beings and also our planet, we are not going to be in a situation where we will not face pandemics like COVID-19 again or other calamities, including climate. So with these words, I will end today's CNSV point, and tomorrow again we will be back with the thoughts and views and perspectives on something that made us think. Bye till then, take care, stay safe, get vaccinated if you're eligible, and get a booster or precautionary dose if you're in India, if your turn comes or if you're eligible. Bye till then, bye-bye.